Which of the following assessment findings would indicate a positive response to furosemide therapy in a patient with congestive heart failure? A. Increased peripheral edema. B. Weight gain of 2 kilograms in 24 hours. C. Decreased lung crackles and weight loss. D. Blood pressure increase. Answer: C. Furosemide, a loop diuretic, removes excess fluid. A reduction in lung crackles and weight indicates decreased fluid overload, showing effective treatment. A nurse is providing discharge teaching for a patient with hypertension prescribed lisinopril. Which statement indicates a need for further teaching? A. I will avoid salt substitutes containing potassium. B. I should report swelling of my lips or face immediately. C. I can stop taking the medication if my blood pressure returns to normal. D. I should rise slowly from sitting to avoid dizziness. Answer: C. Antihypertensive medications must not be stopped abruptly, doing so can cause rebound hypertension. The other statements show correct understanding. Which nursing action has the highest priority when administering blood transfusions? A. Warming the blood before administration. B. Checking compatibility and patient identification. C. Encouraging fluid intake during the transfusion. D. Monitoring urine output every 4 hours. Answer: B. The top priority is verifying the correct patient and compatible blood product to prevent transfusion reactions, which can be life-threatening. A patient with COPD is on oxygen at 4 liters per minute via nasal cannula. The nurse notes confusion and decreased respiratory rate. What is the nurse's best action? A. Increase oxygen to 6 liters per minute. B. Turn off oxygen immediately. C. Reduce oxygen to 2 liters per minute and notify provider. D. Give bronchodilator immediately. Answer: C. Excessive oxygen in COPD patients can suppress their respiratory drive. The nurse should lower oxygen flow and notify the provider promptly. Which finding suggests hypokalemia in a patient on digoxin? A. Muscle weakness and irregular pulse. B. Tingling sensation around the mouth. C. Elevated blood pressure and bradycardia. D. Warm, flushed skin. Answer: A. Low potassium levels enhance digoxin toxicity risk, leading to muscle weakness and cardiac dysrhythmias like irregular pulse. Which is the most appropriate nursing intervention for a patient receiving morphine for postoperative pain? A. Monitor bowel sounds and encourage fluids. B. Restrict fluids to prevent nausea. C. Avoid monitoring respiratory rate. D. Administer naloxone before each dose. Answer: A. Morphine may cause constipation and respiratory depression. The nurse should monitor bowel sounds and encourage hydration and fiber intake. Which diet is best for a patient recovering from iron deficiency anemia? A. Chicken, rice, and apple juice. B. Spinach, red meat, and citrus fruits. C. Milk, eggs, and butter. D. Bread, pasta, and potatoes. Answer: B. Iron-rich foods like red meat and spinach, combined with vitamin C sources, enhance iron absorption and help correct anemia. Which nursing action prevents catheter-associated urinary tract infection, CAUTI? A. Keeping the drainage bag above bladder level. B. Using a closed drainage system and proper hygiene. C. Reusing catheters after cleaning. D. Disconnecting the tubing for repositioning. Answer: B. Maintaining a closed system and proper perineal hygiene reduces bacterial entry and prevents CAUTIs effectively. Which symptoms should the nurse expect in a patient with left-sided heart failure? A. Jugular vein distension. B. Dependent edema. C. Pulmonary congestion and dyspnea. D. Hepatomegaly. Answer: C. Left-sided heart failure causes blood to back up into the lungs, resulting in dyspnea, orthopnea, and pulmonary crackles. The nurse prepares to give insulin Lispro to a diabetic patient before breakfast. When should the insulin be administered? A. 45 minutes before eating. B. Immediately before or after eating. C. 2 hours after eating. D. At bedtime. Answer, B. Lispro is a rapid-acting insulin that should be given right before meals to match food absorption and prevent hypoglycemia. A patient with cirrhosis has ascites. Which intervention should be included in the care plan? A. Increase sodium intake. B. Monitor daily weights and abdominal girth. C. Encourage fluids. D. Restrict protein intake completely. Answer, B. Monitoring weight and girth helps track fluid retention. Sodium restriction and diuretics are also commonly prescribed. A nurse teaches a patient about nitroglycerin use for angina. Which statement indicates correct understanding? A. I will take 1 tablet every 10 minutes until pain stops. B. If chest pain is not relieved after 1 tablet, I'll call emergency services. C. I should take it on a full stomach. D. I can swallow the tablet with water. Answer, B. Patients should take 1 nitroglycerin tablet under the tongue. If pain persists after 1 dose, within 5 minutes, call 911. Which is the earliest sign of hypoglycemia? A. Deep, rapid breathing. B. Confusion and irritability. C. Dry, warm skin. D. Abdominal pain. Answer, B. Early hypoglycemia presents with confusion, tremors, and irritability due to decreased brain glucose availability. Which condition requires contact precautions? A. Influenza. B. MRSA wound infection. C. Tuberculosis. D. Measles. Answer, B. MRSA spreads through direct contact. Gloves and gowns are required to prevent transmission from infected wounds. Which nursing action supports a patient experiencing dyspnea? A. Place the patient supine. B. Elevate the head of the bed to high Fowler's. C. Restrict oxygen. D. Encourage deep inspiration through the mouth only. Answer, B. High Fowler's position maximizes lung expansion and improves oxygenation for patients struggling to breathe. When caring for a patient with a chest tube, which action requires immediate intervention? A. Bubbling in the water-sealed chamber. B. Drainage of 80 milliliters over 3 hours. C. The chest tube disconnected from the drainage system. D. The tubing secured to the bed linen. Answer, C. If disconnected, the system must be reconnected or submerged in sterile water immediately to prevent air entry into the pleural space. A patient with type 1 diabetes is vomiting and unable to eat. What should the nurse instruct? A. Skip insulin doses until eating resumes. B. Take insulin as prescribed and monitor glucose closely. C. Double insulin dose. D. Avoid checking blood sugar. Answer, B. Even when not eating, insulin is needed to prevent ketoacidosis. Blood glucose should be checked frequently, and fluids maintained. Which assessment finding indicates digoxin toxicity? A. Increased appetite. B. Visual disturbances like yellow halos. C. Bradycardia below 60 with strong pulse. D. Elevated temperature. Answer, B. Digoxin toxicity manifests as nausea, bradycardia, and visual disturbances such as yellow or green halos around objects. Which lab result is most important to monitor for a patient receiving warfarin? A. Hemoglobin. B. Platelet count. C. INR. D. Sodium. Answer, C. The INR determines warfarin's anticoagulant effect. A therapeutic range is maintained to prevent clotting or bleeding risks. Which nursing action helps prevent pressure injuries? A. Massage reddened areas. B. Keep skin dry and reposition regularly. C. Use tight linens for support. D. Limit mobility to conserve energy. Answer, B. Repositioning and dry, clean skin prevent tissue ischemia. Massaging red areas can cause deeper injury. A patient receiving chemotherapy reports a sore mouth and difficulty eating. Which food is most appropriate? A. Hot spicy soup. B. Citrus fruits. C. Soft scrambled eggs. D. Toasted bread. Answer, C. Soft, bland foods like scrambled eggs minimize irritation in patients with mucositis caused by chemotherapy. Which nursing diagnosis is most appropriate for a patient with COPD and a chronic cough? A. Risk for fluid volume deficit. B. Impaired gas exchange. C. Acute pain. D. Risk for constipation. Answer, B. COPD affects alveolar ventilation, leading to impaired gas exchange and low oxygen levels, which require oxygen therapy and breathing exercises. A nurse finds a patient with a tracheostomy tube coughing and the tube dislodged. What is the priority action? A. Insert a new tube immediately if trained. B. Call respiratory therapy without assisting. C. Cover the opening with a sterile gauze. D. Administer oral oxygen. Answer, A. If trained, the nurse should reinsert a new tracheostomy tube quickly to maintain airway patency, otherwise, call for immediate assistance. Which electrolyte imbalance is common in patients taking loop diuretics? A. Hypercalcemia. B. Hypokalemia. C. Hypernatremia. D. Hyperkalemia. Answer, B. Loop diuretics cause potassium loss through increased urine output, predisposing patients to hypokalemia and cardiac arrhythmias. Which nursing intervention is appropriate for a patient on neutropenic precautions? A. Allow fresh flowers in the room. B. Avoid all visitors. C. Provide cooked foods and avoid raw produce. D. Share equipment with other patients. Answer, C. Immunocompromised patients should avoid raw produce due to bacterial contamination risk, and strict hygiene should be maintained to prevent infection.